and good morning to everyone who is viewing this video of mine. Well, myself Assistant Professor Samina Mistry from Anjuman Islam Janjira Degree College of Science. The paper that I am going to present today is entitled as Post-COVID-19 Situation in Health Services. In this paper, I have explained the role of health services throughout the pandemic. So let's get started. Well, the COVID-19 pandemic is a global health and economic crisis of a scale never witnessed before. Beginning in China, it has within a few months devastated many countries around the globe, requiring an unprecedented mobilization of health systems. While the disease caused by this novel virus is generally mild and self-limiting, the risk of severe disease is disproportionately high among elderly and those with underlying medical conditions. In the absence of vaccine or treatment, the public health strategies include: the first one goes like this: preventing transmission through early detection and isolation, tracing contacts and quarantining them, and implementation of measures such as social distancing and hand hygiene, etc. The second one is reducing mortality by augmenting clinical management and shielding the most vulnerable populations in the society. The pandemic is yet another reminder that we need to invest in public health, ramp up national capacities to detect a disease early and respond rapidly to emerging infections, strengthen and respect our national institutions, and rely on evidence base for policy making. It is high time that we paid heed to these lessons and strengthened without any further delay our health system capacity, as epidemics and pandemics of this nature will continue to challenge public health well into the future. So let's get into the introduction. We are all in the midst of a global public health crisis that is moving at the speed and scale never witnessed before. The story began in Wuhan city of China in December 2019 when a cluster of unusual respiratory cases characterized by pneumonia was reported. This heralded the emergence of new or novel coronavirus named by the International Committee on Taxonomy of Viruses as severe acute respiratory syndrome coronavirus 2, and the disease named by the World Health Organization WHO as coronavirus disease COVID-19. The cluster was ostensibly linked to a wholesale seafood and wet animal market in Wuhan as if it was a common source outbreak. Subsequently, it was revealed that many COVID-19 cases in fact had no link with the seafood market and that person-to-person transmission was well underway. While the origin of outbreak in Wuhan remains obscure, there are anecdotal reports that the cases with severe pneumonia of unknown etiology were occurring in Wuhan even earlier than December 2019. Well, now let's see what was the response of health system to the COVID-19. Health system and COVID-19. A health system can be defined as the organization of people, institutions and resources that deliver healthcare services to meet the health needs of the population. Implicitly, countries design and develop health systems in accordance with their needs and resources available. Although common elements in virtually all health systems are primary health care and public health measures, including promoting health, preventing diseases and ensuring quality of health service delivery. The first point includes the WHO has provided a more comprehensive definition of health system. A health system consists of all organizations, people and actions whose primary intent is to promote, restore or maintain health. This includes efforts to influence determinants of health as well as more direct health improving activities. A health system is therefore more than the pyramid of publicly owned facilities that deliver personal health services. It includes, for example, a mother caring for a sick child at home, private providers' behavior change programs, vector control campaigns, health insurance organizations, occupational health and safety legislation. It includes intersectoral action by health staff, for example, encouraging the Ministry of Education to promote female education, a well-known determinant of better health, WHO 2007. Health system in country is managed and directed through a set of policies and plans that are evidence-based and developed by the government, ideally in partnership with other partners. Its implementation is often determined by the availability of resources, both human and financial, of supplies such as essential medicines, technology and governance system. This is accountable to the population. A responsive health system should be able to address the needs of the countries based on epidemiological profile and projected as well as perceived needs of community. Now let's see preventing new infections and saving lives. The first point goes like this: public health surveillance for early detection and rapid response. Using an infectious disease model, preventing infection involves identifying the individual who is infectious and rendering him or her non-infectious so that they cannot transmit to others, therefore breaking the chain of transmission. Tuberculosis is a case in point. A person harboring TB bacillus is a reservoir of infection and can spread it up to 10 people during the course of illness. However, when treated with an anti-TB treatment, that patient becomes free from infection and cannot spread it to others, thus breaking the chain of transmission. Coronavirus disease is caused by a novel virus, and at present there is no treatment or vaccine available to treat it. The strategy here should be to detect someone with the disease on the basis of test results or by virtue of case definition. Based on the clinical symptoms of fever, dry cough, difficulty breathing, contact with a known case and loss of sense of smell or taste, and quarantine the individual so that he or she cannot spread it to others, and at the same time to trace the contacts and monitor their clinical status and quarantine if asymptomatic or isolate if symptomatic and testing positive. This is an effective way to break the chain of transmission. The second point goes like this: implementing key public health measures. Now, what is implementing key public health measures? Since droplet infection is the main driver of SARS-CoV-2 transmission, over public health measures recommended are social distancing, frequent and thorough hand washing, cough etiquettes, wearing of masks, even going out, and not touching one's mouth, nose and eyes. Why social distancing? It is now well established that many individuals can be the carriers of novel coronavirus without showing any of the typical symptoms of COVID-19. But these asymptomatic or pre-symptomatic individuals or those with only mild illness can still shed virus and infect others. While the third point goes like risk communication and community engagement. Now, what is risk in communication and community engagement? The role of media cannot be underestimated in ensuring that these public health measures are implemented effectively and people follow the advice given by the government. This includes communicating credible and evidence-based information on a regular basis to public through daily press briefings about the latest situation update, trends, the associated risk and action being taken. Risk communication is a key aspect in shaping the course of an epidemic and empowering people to take right decisions. To encourage protective behavior, they need timely, accurate and easy to understand information. This can help limit the spread of misinformation which otherwise would lead to panic or hysteria. While social media is a good source of information sharing, its careful use is required so that this medium is not used to spread fake news and cause unnecessary alarm that may harm the society and in fact undermine response to the outbreak. The second point includes ensuring surge capacity in case intense and sustained transmission occurs. As and when the community transmission commences, there would be large number of cases that may overwhelm the existing health systems. The requirement of the hospital may overwhelm the existing health system. The requirement of hospital beds and essential supplies such as PPEs, masks, etc. could go beyond what the governments have planned for. These are all the part of pandemic preparedness and response plan which must prepare for in advance. Now, let's see ensuring surge capacity in case intense and sustained transmission occurs. As and when the community transmission commences, there would be a large number of cases that may overwhelm the existing health system. With nearly 1.2 million allopathic doctors in the country, the number of doctors per 1,000 population in India is 0.75, which is also below the norm of 1 per 1,000 population as prescribed by WHO. Medical Dialogues 2020. Moreover, there is major disparity in distribution with respect to the relevant skills, competencies and pandemic training between urban and rural areas. In most remote districts, unfortunately, the number of specialists is almost negligible. In spite of the Indian government's offer of quote your salary and the government will pay, many states have refused to make use of such an initiative while their populations continue to suffer without quality and equitable health care. From the public health point of view, there would be a need for a large number of personnel required for a field investigations, contact tracing and outbreak containment. Therefore, mapping of personnel include the existing network of epidemiologists who are already trained in disease surveillance, outbreak investigation and management can be mobilized at the short notice. In addition, services of many public health professionals who are members of various associations can be sought for support in epidemiological work and data analysis. Now, let's come towards the conclusion. The COVID-19 pandemic is straining health systems worldwide. This pandemic has exposed the poor health system worldwide and impacted healthcare workers badly in all aspects. There are more vulnerable to COVID-19 infection than the general population because of being frequently in contact with affected individuals. They are facing paucity of protective gears, and even assaults. The rapidly increasing demand on health facilities and healthcare workers threatens to leave some health systems overstretched and unable to operate effectively, which directly has major effect on healthcare workers. While currently all the energies in the country are focused on controlling the transmission and curtailing morbidity and mortality due to pandemic, here we take a look at how this infection and this fallouts can impact the healthcare scenario. Despite of all the complications and toil healthcare workers are facing, till they are managing to put forth their best efforts in serving the community. Thank you.